Hello, my name's Professor Chris Edwards from the University of Southampton, and I'm happy to present highlights from Saturday at the ACR Convergence 2020 on behalf of the Cytokine Signalling Forum. As with previous years, there's a huge amount of data, and the variety of abstracts is always really promising to see. So I'd just like to highlight a small selection of the abstracts presented, which related to cytokine signalling blockade. So the RA comparative effectiveness, biosimilars, adherence, and the real world session featured some really interesting abstracts, two of which I'd like to discuss now. When treating RA, we're fortunate to have access to multiple therapy options for our patients, and the importance of that has been highlighted recently in the updated recommendations for rheumatoid arthritis treatment from EULAR. With multiple JAK inhibitors now approved, the efficacy and safety when switching between them is an important consideration, and it's often a question I'm asked when presenting work on JAK inhibitors. So Dr. Miriam Retuerto and colleagues presented their poster on the efficacy and safety of switching to a second JAK inhibitor after failure on the first. So this is poster 0818, and this is looking at the safety of switching. And the background to this is that in recent years, we've been able to take on the use of many new JAK inhibitors, but understanding whether we can swap between them in the way that we have evidence related to swapping between biological therapies is missing. So this sort of study is important. The key results came out of a study looking at a group of patients who were receiving tofacitinib as the first JAK inhibitor, and the other half who were receiving baricitinib. And those results showed that treatment suspension rate of the second JAK inhibitor was the same amongst patients discontinuing the first for inefficacy or for adverse events. And so essentially the response rate to the second JAK inhibitor was similar to the first. And that's an important piece of clinical information for us when we're moving into using JAK inhibitors and deciding whether we can change to another JAK inhibitor after one fails. So another abstract of particular interest in this session was presented by Dr. Leslie Harold and colleagues. The authors used data from a US national observation study to compare the effectiveness of tofacitinib to abatacept in patients with RA. And specifically, this study analysed patients who were anti-citrullinated protein antibody positive at baseline. And there's a little bit of background to this particular abstract, which is 0824. And that is that the Corona registry, the same registry being used here from the US, had previously demonstrated that ACPA positive patients with RA were more likely to respond to abatacept than ACPA negative. And that's a relationship that hadn't been seen either with the biological therapy TNF inhibitors or with tofacitinib. And this study wanted to have a look and see whether there was a difference in responsiveness to those ACPA positive patients for patients with abatacept or with tofacitinib. And so the key results showed that there was no significant difference in the change in the disease activity measure as measured by the CDAI at 6 months in patients starting either abatacept or tofacitinib. There was a little bit of difference in terms of the mean change in disease activity measured by the CDAI at 6 months in those who were biologic or TS-DMARD naive patients in the abatacept versus the tofacitinib group. So overall, this said that patients who were ACPA positive with rheumatoid started with abatacept, or those started with tofacitinib, had a similar response to therapy in terms of disease activity, but also patient-reported outcome. Thank you for tuning in to the CSF's Daily Highlights. We hope it's been informative. Look out for tomorrow's edition, available on our website, cytokinesignalling.com, and on YouTube at Cytokine Signalling Forum. The CSF is providing extensive coverage of the ACR Convergence 2020 on the CSF website. You can find our full abstract search and recommendations in our highlights brochure, which is available now. Look out for presentations from authors of notable papers, as well as our CME highlights of the ACR course, where we go into more detail on some of the most notable abstracts presented.